Hi, I'm Kristy Mascarenhas. I'm an ophthalmologist with Hartford Hospital Eye Surgery Center. And as an ophthalmologist, that means I do cataract surgeries just like most of us, but I'm also a glaucoma specialist, which means that I do medical, laser, and surgical treatment of glaucoma. We have lots of things that can help us make the diagnosis of glaucoma earlier than we ever have before. But one of the things that I like about the surgical treatment of glaucoma is we have minimally invasive glaucoma surgeries that we didn't have when I was training. And we get to offer people choices these days about the types of surgeries and the types of procedures that they get. My philosophy of care is to take care of that whole person, even though this is one disease that's affecting one part of their eyeball. That disease affects that entire person's life. So when I treat that disease, I want to make sure that the treatment is something that that person can tolerate, and I want to make sure that that treatment and the disease affect that person's life as little as possible. So I thought I might want to do medicine since I was a small child, but it was probably my own ophthalmologist that put the idea in my head when I was young. I'd been wearing glasses since the age of 6. I had grandparents who were Lions, and I went to the Lions Club meetings with them and thought that I'd like to take care of people who were visually impaired or blind. So in medical school, I realized that I could do all the things I wanted to do in ophthalmology. I could work with my hands, I could do procedures, and I could get to know my patients really well, visit after visit. And over the last 12 years or so, some of them, it's no exaggeration to say that they become like family. One thing patients should know about me is that I like to teach. I'll teach you about the disease that you have, and I'll make sure that you don't leave without understanding what we're going to do and why. So a few things I like to do outside of medicine. I like to get outside, I like to hike and bike, and I think that recharges me for when I go back into the office. Another thing I like is I like reading mystery novels. I've liked solving mysteries since I was a kid, and that probably has gotten me into medicine in the first place. I thought there were mysteries to be solved there too.